Magnesium sulfate is a life-saving medication in the pre-hospital setting, effectively treating torsades de pointes, controlling seizures in eclampsia, correcting hypomagnesemia, and providing relief during severe asthma exacerbations. Its broad range of actions makes it a critical tool for paramedics in emergency care. Magnesium sulfate is a critical electrolyte that helps regulate many important bodily functions, particularly by correcting low magnesium levels. In the pre-hospital setting, paramedics often administer magnesium sulfate for several life-threatening conditions, thanks to its unique pharmacological actions. Let's break it down. Magnesium sulfate works by reducing striated muscle contractions and blocking peripheral neuromuscular transmission. It does this by decreasing the release of acetylcholine at the myoneural junction, which limits the stimulation of muscles and reduces excessive muscle activity. This mechanism is particularly useful in managing eclampsia, where it helps control seizures in pregnant women, as well as torsades de pointes, a type of life-threatening arrhythmia, by reducing the risk of further abnormal muscle contractions in the heart. In addition to these effects, magnesium sulfate also acts as a calcium channel blocker. By blocking calcium from entering cardiac and smooth muscle cells, it stabilizes cardiac cell membranes, which helps to regulate heart rhythm and prevent arrhythmias like torsades de pointes. This is why it is the treatment of choice in certain arrhythmias, particularly in the setting of severe hypomagnesemia, where low magnesium levels contribute to abnormal heart rhythms. Finally, in patients experiencing severe asthma exacerbations, magnesium sulfate works by relaxing bronchial smooth muscles. This occurs through its calcium channel blocking properties, which reduce bronchoconstriction and help improve airflow, making breathing easier for the patient. Magnesium sulfate is a life-saving medication in the pre-hospital setting, effectively treating torsades de pointes, controlling seizures in eclampsia, correcting hypomagnesemia, and providing relief during severe asthma exacerbations. Its broad range of actions makes it a critical tool for paramedics in emergency care. When administering magnesium sulfate in the pre-hospital setting, it's typically given intravenously or intraosseously. Here's how it's done. For seizures, eclampsia, magnesium sulfate is administered as an IV IO bolus of 4 to 6 grams over 20 to 30 minutes, followed by an IV IO infusion of 1 to 2 grams per hour, depending on the patient's response and condition. For arrhythmias, in cases of torsades de pointes, magnesium sulfate is given IV IO with a dose of 1 to 2 grams over 5 to 20 minutes, and for pediatrics, a dose of 25 to 50 milligrams per kilogram IV IO over 10 to 20 minutes with a maximum dose of 2 grams. For asthma, magnesium sulfate is given as a loading dose of 2 grams IV IO over 20 minutes, and for pediatrics, a dose of 25 to 50 milligrams per kilogram intravenous or intraosseous over 20 minutes with a maximum dose of 2 grams. While magnesium sulfate is effective, it's essential to monitor your patient carefully during administration. Vital signs: keep a close eye on blood pressure, heart rate, and respiratory rate. Magnesium sulfate can cause hypotension and respiratory depression, especially with rapid infusion. Reflexes and neurological status. In some cases, excessive magnesium sulfate can cause deep tendon reflex loss, so always assess the patient's neurological function throughout treatment. Renal function. If the patient has renal impairment, the drug should be used with caution, as magnesium can accumulate and lead to toxicity. Magnesium sulfate is an invaluable tool for paramedics in treating life-threatening conditions like seizures, arrhythmias, and asthma. Understanding its proper administration, monitoring, and potential side effects is critical for safe and effective pre-hospital care. Always remember, follow your protocols, ensure appropriate dosing, and monitor your patient carefully for any adverse reactions.